Hey, lovely people. It's Seth. Today is October 15th, which means I'm like 4 days away from being 9 months on T. Um, and I have some really good news, actually. I just uploaded that video a day ago or 2 days ago. Um, that was my little after top surgery consultation video. I had been to see Dr. Bartlett in Boston. On Thursday of last week. So yeah, that kind of addressed, going to see him. And when I left, you can tell by my video, I was not sure that I was really sold on a surgery that involved so many um, what ifs, I guess. Um, I, I guess it just made me really uneasy to think about the fact that it's really based on how your body heals. And like, I'm so I have a small chest, so it's great for keyhole. But just the risk factors in terms of like not really being able to control placement as much, and not really being able to control like the nipple resizing, um, not really being able to control whether there'll be that extra little patch of skin on my right side, um, and whether or not I will need a revision, which will cost me an extra 1,500, which like puts me up in the 10,500 range in terms of surgery. Like, that is so much money, and I will have to work for so long to pay my parents back for that. Um, they're giving me a loan for surgery so that I can get it sooner rather than later. But either way, I'm still gonna have to pay it back, and right now I have almost 2,000 saved. So what hit me was like, wait, like, I talked to a couple people who'd had surgery with Garamoni, and I realized like that whole bedside manner component is a huge deal to me, and the placement is also a really big deal to me. And he makes your pecs look, nice and outlined. And I have a consultation on Wednesday with Dr. Garamoni, and like, just right now thinking about that, like, I have a giddy feeling inside, like I'm excited all over again, and I'm really happy, and I feel for some reason like it's a really good decision, and I've never really felt that before. Like, I've always been excited for top surgery, but for some reason I never was really thinking about having it with Dr. Garamoni. I thought, why not wait until procedures have kind of advanced a bit to the point where like possibly having a procedure like keyhole and not having scars is an option. Like, that's a great part about being patient and waiting for things to kind of move along in the medical field and be better for trans folks. But like, I still don't really think that that really matters now. I think like I'm still super impressed by Garamoni's work, and I always have been, and I just overlooked that and kind of was thinking more about like scars and treatment afterwards, and like, what if I could just avoid that? And like, it it doesn't really matter anymore. It's like, I'm super pumped and excited to maybe have surgery with Garamoni if he has any openings. And the nice thing is that like, I would be paying half the price I'd be paying to go see Bartlett, and it would be um, he doesn't accept insurance. So like, I didn't mention this in my last video, but my parents wanted me to wait until our insurance potentially could cover, because they are potentially adding some SRS benefits to the plan that they have, and my parents have that insurance company through work. So they kind of heard through the grapevine that like the LGBT committee at the workplace was trying to get SRS stuff covered under insurance. So like, if I was going to Bartlett, obviously we would want to wait, so that we didn't just blow $10,000 out of pocket and then hear that it was covered. So potentially I could be waiting till summer, and then I could be waiting past summer. Like, we don't even know when the benefits would be added. But with Garamoni, you know, for example, if I went to Bartlett and had insurance cover, it could only cover to the point where it was 6,000. Maybe they would cover 4,000 of it, and I'd still be paying 6,000. Well, that's pretty much Garamoni's cost, plus like prescriptions and whatever else stuff. The estimate cost of the surgery and the anesthesia and stuff. So yeah, it just like kind of all makes sense, and I'm really stoked. Um, if this works out, I have a phone consultation. I've sent him some photos of my chest, and I'm excited to hear what he says. I'm also a little bit still nervous because Bartlett said that I wasn't really a good candidate for double incision, but I think he was saying that in terms of like if you had the choice of two procedures, go with keyhole because you're like an A or smaller, and that's because the testosterone's kind of reduced the density of the tissue, and made it easier to bind and all that. So yeah, I'll be interested to hear if Garamoni says that or if he says no, double incision is good for anybody, because I feel like I've seen a lot of people get it. So yeah. This isn't to say that Bartlett's not still on the table, but I just feel like I was so scared of the risks in terms of like the look of the areola after the procedure and the placement, and that when he did clearly warn me about my right side and say that there was a little bit of extra skin that may kind of cause a little bit of a bump or pocket underneath. So yeah, I'm like super happy right now. Like I feel like there's been a weight like lifted that I could make a decision in my transition that feels really good. It kind of, yeah, like I can tell a lot of times that I'm stressed by something, but it takes me a little while to figure out how to fix that stress and how to like make my transition easier. And sometimes the option is right in front of me, and I'm stoked. And potentially like everybody that I'm close with who's a trans guy like has had, or trans masculine individual like has gone to Garamoni and loved it. So I've seen some really impressive procedures, and like everyone looks so good. I don't know why I didn't think to just go to Garamoni. Anyway, so yeah, I'm excited for Wednesday, and potentially he'll be booked up through January. I mean, he's a busy guy. He does a lot of procedures. But if not, then I could be having surgery on New Year's Eve-ish / afterwards. And it would be like the best Christmas gift ever. Yeah, so after a couple disappointments and a very depressed week, I have to say, last week before I went to go see Bartlett, I was pretty weirded out by a lot of emotions and stuff. I think that on testosterone, like, emotions, whether good or bad, like, tend to just lay so under the surface that I can't properly express myself and deal with them, so I just end up becoming, I don't know, it's just like I feel the tension in my body a lot more than I used to, and I'm not working out, and maybe that's why, like, if I went and physically exerted myself, I could get rid of a bit of that tension when I'm stressed. So yeah. What else? I have been doing my tee shots, and like it's getting a lot easier actually. I've moved the location that I'm doing my shots in a little further down the leg towards the knee, into the big muscle area. So like, my jeans aren't really good to see, but okay. So I was doing them here more, like near the hip bone, and it was hurting a lot. And when I went in to go get someone to help me do it, they did it like here in the more muscular area, still like on the upper right quadrant, but here, like kind of at the very end of it. And yeah, doing it there like really doesn't hurt at all. And now I'm like not afraid to do it in my left side, and I haven't had any real excessive bleeding. I haven't had any tea coming out really, and that's like a shock. I'm either just calming down and becoming less like tense when I'm doing my shots, or like I'm just doing them a lot better and in a better location. So yeah, shots are getting easier, and I feel comfortable about them now. I'm not like scared of them. I used to get really sweaty and nervous every time I was about to do it, and now it's like getting a little bit nicer. So yeah, I've been doing my shots for the past couple months. Like I did it all summer as well. What else? I'm passing all the time. I realize bathrooms are still kind of an issue, you know, because I don't like the concept of using an STP. It's a little bit too complicated to like bring something around, and then like, do you wash it? Do you just put it back in your pocket? Like, how do you get it out in the first place and put it in your pants? Like, so I don't use an STP, and I go in the men's restrooms, and I just still have a little bit of anxiety every time I open that door. I'm like, shit, what's going to be inside? But you know, it's getting a bit easier. Yeah, my parents are coming to visit me here at college next weekend, so it'll be really good to see them, and we can talk all about top surgery and stuff, and we've been communicating via email, so